Hello everyone, my name is Nareda Sasenya and today I will be presenting my research titled Roots of Hope, Diabetes Prevention Through a Pandemic. Diabetes mellitus is a group of metabolic diseases characterized by chronic hyperglycemia, resulting from defects in insulin secretion, insulin action, or both. Type 2 accounts for approximately 90 to 95% of all diabetic cases. 34.2 million Americans are diagnosed with diabetes, which is 1 in every 10 people. 1 in 5 of those individuals do not know that they have diabetes. Approximately $327 billion is spent yearly to treat diabetes and its long-term effects, such as stroke, heart attack, kidney disease, and peripheral neuropathy. The Diabetes Prevention Program, or the DPP, was a randomized controlled clinical trial that compared a lifestyle intervention of diet and exercise with the anti-diabetes drug metformin to determine whether lifestyle intervention, or metformin, was more effective at preventing or delaying the onset of type 2 diabetes in people with impaired glucose tolerance. On the left side, you can see a graph of the results from the DPP randomized clinical trial. The graph shows the diabetes incidence versus time in years. All the participants in the study were at high risk of developing type 2 diabetes. People who received no treatment or intervention are shown in the blue line. People who received the lifestyle intervention are in green, and people who took the anti-diabetes drug metformin are shown in red. What you can see is that over the 4-year period of the study, the cumulative incidence of type 2 diabetes was lower in the red group that took the drug metformin than it was in the blue group that had no intervention. When you look at the incidence of type 2 diabetes in the green group that had a lifestyle intervention, you can see not only was it lower than the blue group that had no intervention, but it showed an even lower incidence of diabetes than in the red group that took metformin. Taken together, the DPP data showed that people who are at high risk for type 2 diabetes can prevent or delay the incidence of diabetes and cut their risk of type 2 diabetes in half by losing weight through changes in diet and exercise. Although we are still in the COVID-19 pandemic, data has been gathered on the effects pandemic policies have had on different populations. For example, in people with diabetes, increased levels of perceived stress, weight gain, and less exercise have been reported throughout lockdown. In Italy, weight gain was observed in 48.6% of the population ages 12 through 86 years old. And in the United States, weight gain was reported between 22 to 27.5% of the population. While the DPP did show that lifestyle intervention reduces the incidence of type 2 diabetes, the trials were conducted in a controlled hospital setting and not during a pandemic. Previous research before the pandemic shows that a similar program can effectively decrease the incidence of type 2 diabetes in a community setting. Whether the DPP or a similar program can effectively decrease diabetes risk in a community setting during a pandemic is unknown. The aim of my project is to see if a CDC diabetes prevention curriculum could be conducted in a community setting for a diverse population from LA County during the COVID-19 pandemic and still have similar results as the DPP. Participants could qualify for the diabetes prevention program based on either their hemoglobin A1C in the prediabetic range or a score greater than or equal to 5 out of 10 on the American Diabetes Association, or ADA, Diabetes Risk Survey. The ADA Diabetes Risk Survey is a series of 10 questions about age, weight, activity level, and family history that estimates diabetes risk. The glycated hemoglobin, or hemoglobin A1C test, is an important blood test that determines if a body is managing its glucose levels. Hemoglobin is a substance in red blood cells that carries oxygen to tissues. It can also attach to sugar in the blood, forming a substance called glycated hemoglobin, or hemoglobin A1C. The percentage of hemoglobin molecules with sugar attached is proportional to the amount of sugar that has been in the blood over the past 3 months. Hence, the test provides an average blood sugar measurement over a 3-month period. A hemoglobin A1C percentage of less than 5.7 is considered healthy or normal. A percent of 5.7 through 6.4 is considered a diagnosis of prediabetes, whereas a hemoglobin A1C percent greater than 6.4 is considered type 2 diabetes. Females with a history of gestational diabetes were also included in the study. Participants were then enrolled in a year-long diabetes prevention program following a CDC curriculum. The program consisted of 22 sessions, 16 of which were given in the first 6 months of the program and 6 of which were administered in the last 6 months. Participants were asked to set individual goals to decrease their body weight by 5 to 7% and to increase their moderate activity minutes to a minimum of 150 minutes per week. At the beginning of the program, a participant's starting biometric data was collected. A validated baseline survey was also administered. Weight and activity minutes were recorded at every session following this one, and a validated survey was administered after every session meeting. Session 1 through 8 were given weekly and focused on an educational topic such as healthy eating, nutrition education, stress management, exercise, and mindful eating. Sessions 8 through 16 were administered bi-weekly, but still focused on similar topics such as those previously mentioned. At 6 months, the second of the biometric measurements were collected, and the first post-survey was administered to the participants. Sessions 17 through 22 followed monthly up until the 12-month mark of the program. These sessions again focus on similar topics such as those previously mentioned. At 12 months, the final set of biometric data was collected, and the final post-survey was administered to the participants. Weight was collected at each session and rounded to the nearest whole pound following CDC instructions. Activity minutes were self-reported at every session. The percentage of glycated hemoglobin was measured through a finger prick blood sample using a commercially available A1C Now kit. Waist and hip measurements were rounded to the nearest centimeter, and the blood pressure was measured using a Paramed digital automatic blood pressure monitor. Data was analyzed using a paired t-test. The average body weight at 0 months is 217 pounds. The average body weight at 6 months is 213 pounds. There is a 1.8% decrease in body weight with a p-value greater than 0.05. The average number of activity minutes was 281.8 minutes per week at 6 months. Glycated hemoglobin was the main measure used to assess type 2 diabetes risk. At 0 months, the average percent of glycated hemoglobin was 5.8. Based on the scale, this qualifies as pre-diabetic. By 6 months, the average glycated hemoglobin dropped to 5.7%, which is still considered pre-diabetic. The average of glycated hemoglobin at 6 months has a p-value greater than 0.05, meaning that it is not significant. Although the results of the study showed an increase in physical activity and a decrease in participant body weight and hemoglobin A1C levels, they were not significant enough to say that a DPP program provided through a community setting in LA County during a pandemic is indeed successful at reducing the risk of developing type 2 diabetes. Thank you all very much for watching.